Welcome to The Explainer. Today, we're demystifying a piece of medical tech that's honestly as fascinating as it is ubiquitous. And that's the transdermal patch. We're going to explore the underlying science, the real-world applications, and of course, the strict protocols that make these discrete little patches so incredibly effective. Let's get into it. Okay, let's dive into this with a really simple but profound question. What if a sticker could replace a needle? Just think about that for a second. We're talking about an incredibly simple concept, literally stickers that heal. No painful jobs, absolutely no complicated IV setups, just a small, highly sophisticated patch sitting right there on your skin doing all the heavy lifting of modern pharmacology. Here's our roadmap for today's journey. First, we'll look at the magic of transdermal delivery, then exactly how the patch actually works. After that, we're weighing the pros and cons, looking at patch types and common drugs, and finally, we'll wrap up with a highly practical step-by-step application guide. Starting off with Section 1, the magic of transdermal delivery. To really appreciate this tech, we have to remember the traditional pain points of drug delivery, right? The sheer discomfort of IVs, dealing with hazardous syringes, or even just the daily struggle of swallowing pills. Well, the solution here is transdermal medication. By definition, this is the administration of drugs through the skin via patches for a slow, controlled release directly into the bloodstream for systemic distribution. You can think of it like this invisible, microscopic reservoir that's on a slow drip, completely bypassing the needle. Which brings us to Section 2, how the patch actually works. Now, what's really interesting about this slide is the sheer engineering packed into something that is practically paper thin. A standard transdermal patch generally has 4 key layers. Right on top, you've got the backing layer. That gives you external protection from water and friction. Next down is the drug reservoir, or the matrix, which holds the actual payload of the medication. Below that is the release liner, which you peel away right before application. And finally, the adhesive layer, which obviously keeps the whole thing firmly stuck to your skin. Once that adhesive layer hits your body, an incredible microscopic journey kicks off. The medication is released at a tightly controlled rate and has to permeate downward through your skin layers. It starts at the very top, the stratum corneum, travels down through the epidermis, and then hits the dermis. Ultimately, it reaches the capillaries deep within your skin. From there, it's swept away to be distributed systemically throughout your entire body. Moving on to Section 3. Weighing the pros and cons, because, of course, these aren't just a magic bullet for every single drug out there. Let's really look at the balance here. On the pro side, you're getting a constant, controlled release over time. It is totally non-invasive, so no injection pain, no infection risk. Plus, huge bonuses here. It entirely avoids the digestive system, meaning stomach acid can't destroy the medication, and it bypasses liver processing for much more direct bloodstream delivery. But look at the cons. Some patients definitely get local skin reactions, like irritation. Absorption can also vary wildly depending on the person and exactly where the patch is placed. Plus, they're generally more expensive to manufacture than your standard oral pill. And crucially, they are limited to specific molecular properties. The drug molecules literally must be small and lipophilic, which means fat-soluble, to actually pass through that skin barrier. Let's jump into Section 4, patch types and common drugs. And this brilliantly illustrates how the physical design of the patch dictates exactly how it functions. We've got 6 main types here. There's the simple single layer, where the adhesive itself acts as the drug reservoir, versus the multi-layer for more complex, controlled release. Reservoir patches use a separate specific membrane for precise dosage control, while matrix patches embed the drug right in a matrix between the backing and the adhesive. You even have vapor patches that release substances for inhalation, like essential oils, and micro-reservoirs, which suspend the drug in tiny reservoirs within a gel matrix, basically combining the best of the matrix and reservoir types. So what are we actually putting inside all these patches? Honestly, the variety is staggering. We use them for powerful pain relievers like fentanyl or buprenorphine, and for hormones like estrogen and testosterone. They're used for cardiovascular issues, delivering nitroglycerin for chest pain. There are neurological patches for things like Alzheimer's and Parkinson's, widely known smoking cessation aids like nicotine, and even antidepressants. It really grounds this complex pharmacology in very relatable human health issues. However, before we get into the application, we absolutely have to note the potential side effects to watch out for. The most common, by far, are local skin reactions, so redness, itching, a rash, or swelling exactly where the patch sits. Depending on the drug, you might also see systemic side effects like dizziness, nausea, or a headache. And while it's rare, true allergic reactions can happen, and those require immediate medical attention. That brings us to Section 5, Step-by-Step Application Guide. If you're a caregiver, a nursing student, or a patient managing your own care, consider this your practical masterclass. Let's start with Phase 1, prep and placement. First, always review the order for where it should go, usually the chest, arm, abdomen, or hip, to ensure efficient absorption. Second, remove and properly discard the old patch. Third, clean the area with water and dry it completely. That is so important. No soaps, no lotions, no oils, or the new patch just won't stick. Finally, open the pouch carefully without touching that adhesive layer. Next up is Phase 2, application. Immediately press the adhesive side onto the skin. Now, you need to hold it firmly in place for at least 30 seconds. That firm pressure is exactly what ensures it sticks well and doesn't come loose around the edges. If the edges do happen to get loose later, you can use first aid tape to secure them. And hey, if it falls off early, don't panic. Just apply a new one to maintain your schedule. Finally, we have Phase 3, post-care. As soon as you apply the patch, wash your hands with water immediately. So the crucial point is preventing accidental medication exposure to other people or to yourself. You definitely don't want to accidentally rub powerful meds into your eyes. Apply the next new patch to a completely different skin area, and always fold the used patch adhesive sides together before you dispose of it. Let's move to and see how this builds into our final nursing considerations to maximize drug absorption and safety. Always choose clean, intact, and hairless skin. Rotate your patch application sites constantly to prevent irritation. Avoid skin that is excessively thin or thick to ensure even absorption. Keep the patch dry from prolonged moisture. And lastly, never, ever overlap new patches over previous areas. From bypassing the digestive system entirely to carefully engineered microscopic layers delivering exact doses of life-changing medications, transdermal patches are an absolute marvel of modern science. As this tech expands to carry even more types of medications with greater precision, it leaves us with a pretty exciting question. Will the future of medicine simply be worn on our sleeves? Thank you so much for joining me for this explainer. I hope you walk away feeling empowered and eager to learn more about this incredible technology.